This cannot be a coincidence, can it, that the nurses and a lot of people on the left don't particularly like Steve Barclay and his policy when it comes to a pay rise for them, and now all of a sudden he's a raging bully, is he?
No, he isn't. Absolutely not. I mean, I don't know Steve well, but I have met him. In fact, funnily enough, the first time I met Steve was when I was attempting to become a parliamentary candidate for the Conservative Party, and he interviewed me. And I found him absolutely charming, terribly engaging. He certainly wasn't a bully in that interview when arguably you could say he should have been a bit of a bully to test people out and see how well they'd perform under pressure. But he was absolutely lovely. And I think we've got a situation now. It's not so much anymore, I think, ministers doing the bullying as the civil servants bullying the ministers. Now, perhaps they were emboldened by the report into Dominic Raab last week, which forced him to resign, even though on the face of it, his peccadillos didn't seem to be very great at all. He was pretty much exonerated of more or less every claim bar two against him. And the report, you look at it, all he was trying to do, I think, was trying to get people to do their best work and calling them out when they didn't do their best work. Now, I wonder if people in the health service, and as you said, Patrick, then the NHS isn't known for its right-wing tendencies, its conservative tendencies, let's put it that way. I think we've seen several conservative health ministers out of a job through some kind of not terribly exciting scandal, whereas Labour ministers, when there's been a Labour government, in my recollection, the health service can go to hell in a handcart, and they seem to be quite safe in their jobs. So I suspect there were people who were emboldened by that report into Dominic Raab last week and have now decided that they'd like to bring down another, in their view, unpopular Conservative minister.
What do we do, Suzanne? Do you have to say a phrase that you're not really supposed to anymore, which is just man up?
It's a good phrase, and I mean sometimes that's what is called for, and maybe that's the kind of approach that Steve Barclay took with the health service and the civil service. It's not performing well. We've got waiting lists at a record high. We've got junior doctors and nurses holding the country to ransom. I mean, let's not forget that the nurses have rejected a 5% pay rise against the advice of their own union, the Royal College of Nursing. It is increasingly beginning to look like they're trying to bring down a government rather than stand up for their own rights. And I'm sure we can all recall pictures of the picket lines outside hospitals, which don't so much say, fair pay for a fair day's work, but down with the Tories.